Assalamu alaikum, Dr. Saib. Welcome to the channel. The MCQs is a 16-year-old male is brought to the physician for a routine sports physical. The patient is noted to be in the 98th centile for height and has a tall, slender build with long fingers. He has a history of mild intellectual disability and recently underwent surgery for displaced lens in his left eye, which was noted to be shifted downward and inward. Given his presentation, his physician is concerned about a metabolic disorder involving sulfur-containing amino acids. Which of the following dietary modification is most appropriate for this patient? First, we have to identify the disorder, what disorder it is. So, from the buzzwords, the patient with 98th centile mean his height is he is heighted and tall, slender fingers, which points toward a Marfanide habitus, like he has Marfan-like features, and thus lens subluxation, which is downward and inward. This is a classic presentation of homocystinuria. In homocystinuria, the lens is subluxated downward and inward. Let's study the homocystinuria topic and then come up to choose the best option here. So this is the homocystinuria. Homocysteine levels. Homocysteine is an enzyme that is found in the body. This homocysteine converts into cystinuria because of cystinuria synthase enzyme. While this also converts into methionine because of methionine synthase enzyme. If any enzyme is deficient, it will lead into the accumulation of homocysteine levels in the body, which will lead to homocystinuria. Mean the homocysteine level will accumulate in the body so much that it will start excretion in the urine. Not just these two enzymes, but the deficiency of B6 and the methylbutyl or methylfolate or methyl tetrahydrofolate reductase. This deficiency can also result in the increased level of homocysteine, as it will not convert into cystinuria or methionine. As this homocysteine level builds up in the body, it will cause certain features. The common one is the Marfanide habitus, as we discussed in the MCQs. With this Marfanide habits, what will happen? The patient will be heighted. He will have long, slender, thin fingers. He will suffer from lens subluxation that will be downward and inward. As you see, that will be downward and inward. You have to differentiate this from the Marfan. In Marfan, also subluxation happens, but that is up and upward, up and outward. You can remember that and you can differentiate from this mnemonic Marfan. In Marfan, it is fan, and fan is up. So in Marfan syndrome, sun lens is subluxated upward and outward, while in homocystinuria, lens is subluxated downward and inward. Other than that, the most common and important features that happens in homocystinuria is the thrombosis and atherosclerosis, which leads to stroke and MI. So this can also come up in MCQs that a patient presented with the history of stroke or MI and lens subluxation. What could this be? So it points all toward the homocystinuria. So now comes to this MCQs. As I mentioned to you that homocysteine won't be converted to methionine, so you have to add methionine in the diet. Okay, so you have to add methionine so that the body deficiency is met. So now comes to these options. Increase methionine intake, decrease methionine intake, decrease cysteine intake, decrease phenylalanine, and decrease valine intake. So the correct option, you are right, is increase methionine intake. You have to increase the methionine in the body. You have to take methionine in the diet to cover for these deficiencies. This is wrong option. While the decreased cysteine intake, you have to decrease the cysteine in cystinuria. Decrease phenylalanine intake, this points toward the phenylketonuria. In phenylketonuria, you have to decrease the phenylalanine intake, while you have to decrease the valine intake in maple syrup disease, in which branch chain amino acids like leucine, isoleucine, and valine, you have to inhibit. You have to avoid these amino acids in the diet. Now study with this another amino acid disorder, that is cystinuria. How cystinuria occurs? You have to first understand that this thionine further converts into cysteine, and two molecules of cysteines form cysteine. and this is then the amino acids that are absorbed in the proximal convoluted tubule in intestine have deficiency or are defect in the transporters, which leads to the excretions mean they don't absorb. So the cysteine, ornithine, lysine, and arginine, which you can remember by the word cola. These amino acids excrete in the body, and these amino acids have the tendency to form kidney stones. Is written here, it forms hexagonal cystine stones, and these are recurrent. So a patient will come up to you with recurrent kidney stones symptoms, and when so you can make a differential of cystinuria. How you can treat now this cystinuria? What you have to do, the first thing you have to do is to make the urine alkaline, because the cystine stones that are found in the acidic environment. So if you make the urine and the environment alkaline for it, it will decrease the formation of urine kidney stones. So you have to do urine alkalization, and the other thing, you have to decrease the methionine. In this, you have to increase the methionine in the diet, while in cystinuria you have to avoid methionine. How you can confirm? You can do urinary sodium cyanide nitroproside test. It will come as positive. And remember that although both of these amino acid disorders are also autosomal recessive. I hope you won't remember one thing more. In homocystinuria, homocysteine doesn't accumulate just in this condition. Homocysteine levels also increase in vitamin B12 deficiency. When vitamin B12 is deficient, homocysteine build up in the body. Also in vitamin B9 folate deficiency, homocysteine levels build up in the body. So they can also present with increased level of homocysteine. Thank you for your time.